And after this experience, you took a career break, I believe for reasons.
Yeah.
How did this I don't know impact your career, or like maybe help you to reflect on life?
Yeah. So at the time, I was only there probably about 6 months, and then my husband got a job in Sacramento. And we knew we wanted to leave LA eventually, but that opportunity came up, moved out here, and I was just looking for a bunch of jobs. But yeah, during that time when I was job searching, it really allowed me to narrow down my focus. Like, hey, what do I actually want to do? I didn't want to, I put a lot of intention into it, basically, is what I'm saying, right? I didn't want to
Mhm.
just take whatever public health role that came about. I wanted to be more intentional. I knew I still wanted to be in health education at the time. So when the health educator role popped up at Sacramento County, I jumped on it. Luckily, I got it. And, the rest is history. Been there 6 years now. But, but yeah, during that time, I was able to reflect on my past experiences too, and just the growth over that time, right? Where have I come? How long have I come? How far have I come, rather, from my MPH to now, and all of the roles that I've had, and how can those roles directly impact my current role at the time, health educator, right? So yeah, it was tough. That transition was tough, moving to a city, not knowing hardly anybody, and starting over again. But yeah, it ended up working out in the long run.
Absolutely. And maybe like reflecting on, because I like the idea of not just choosing any role, but choosing roles that like resonate with you. What was that kind of process for you to kind of whittle down to say, like, these are the things that are important for me in a role?
Yeah, I knew I wanted a role where I could make direct impact, and preferably a role where I was able to meet with the community, be with the community, whether that be going out and doing group education classes or even 101 uh, classes and things like that. So I knew I wanted to not just be behind a desk, right? I didn't want to just do computer work. Um, I realized like the further I kind of go up in my career, it is unfortunately becoming a little bit more of the computer work. But
Hmm.
anywho, yeah, that's what I was focused on at the time. I definitely wanted to be directly in the community, seeing what their needs were, providing that health education, and really just making that, I guess, more direct impact, if that makes sense.
Yeah, absolutely. So you said that the role that you were able to get was the health educator role at Sacramento County Public Health. Tell
Yes.
us how I guess, yeah, tell us the process of getting that role, and what did you do in that role initially?
Yeah, yeah. So I was hired on for health educator role in the tobacco prevention program at the time. In that role, it was actually a little bit of policy work, but I later realized I didn't love that side of public health so much. It was a lot of policy work, but I did learn a lot. It was kind of cool. We were able to go to like the city council sessions and things like that to see what the community was saying, because at the time, the city of Sacramento wanted to ban flavors in vaping products and tobacco products. And so I came in right in the heat of that. So that was kind of cool to see. We were able to see how the community felt about it. They were giving their direct feedback on it. We were sitting in, we were taking notes. We really wanted to understand um, both sides, really, right? Folks were coming in like, hey, this is going to impact my business. If I have a vape shop, if flavors is banned, that's 80% of my inventory. How am I going to make money? So it's like, okay, I can understand a business owner, but right. Um, some folks are coming in like, hey, like, I understand you guys want to eliminate these tobacco products, but I that's how I manage my stress. I smoke, right? What other strategies are you going to give me to help me manage my stress? The job, things like that. So hearing both sides was really, really interesting. Hearing all sides was interesting. So I came in the thick of that, and I was able to do a lot of community outreach involved with tobacco education, and like I said, seeing that policy side as well.
That is fascinating, and that's, I think that really paints a picture of like how nuanced the work that public health is. And like, yes, because just because people say, oh, tobacco is bad, it's bad for you smoking, doesn't mean that's not what someone like wants to do and is healthy to them because it's reducing their stress and they have
Right.
nothing else going for them in life,
Right.
and to take away this one thing is, yeah, so it is
Yep.
very nuanced conversation in a lot of
Yeah.
ways.
Yeah. I learned that like a lot of folks with mental health conditions utilize tobacco products to minimize their symptoms and their stressors, right? Because it's like that fixation of like, hey, I need to be fidgeting with something. I need to, that oral fixation of like smoking and things like that. So it really, it opened up my eyes to what people are experiencing.
Yeah, absolutely. And so you've been with Sacramento County for a while now. You have had many roles, going from the health educator in the tobacco program to now human services program planner. Can you maybe walk us through some of the highlights from going there? Because I know you were also a nutrition health educator.
Hmm.
And then tell us about what you do currently.
Yeah. Yeah. So started out in tobacco education, as I just talked about, and then went into our CalFresh Healthy Living program, also known at the time as obesity prevention program. Helped them with that name change. So I was there for a couple of years. As I was doing a lot of contract monitoring in that role as well. So working with community-based organizations, helping them meet their grant criteria and all of that, making sure they're on track with their goals, objectives, and all of that good stuff, community outreach, health education, and all that. COVID did kind of put of course, a little pause in things. We couldn't go out in the community as much. We pivoted a lot to virtual education and things like that. Worked a little bit actually as what was the title? I want to say emergency services worker at the county during COVID. So kind of threw that a little bit in there as I was a health educator as well. And so then last year, I actually became a human services program planner in the maternal, child, and adolescent healthcare program. And so in my current role, I serve pretty much as a support or liaison between all of the public health nurse home visiting programs at the county. So that we have something called community nursing, we have Black Infant Health, Nurse Family Partnership, and really helping those programs recruit more members, basically, if you will, to utilize those services. In those programs, basically, what happens is our public health nurses go out, they do home visitation for folks that are just experiencing postpartum issues. Um, they might have children with special needs, all of that good stuff, and they're really those nurses really go in and they're addressing all the social determinants of health and all of that. So I support those programs, their reporting and all of that. I also support the child health programs at the county as well. So that's our lead poisoning prevention program, as well as our oral health program, which that part's kind of newer to me. I just signed on to time study to that program pretty recently, and we're going to be doing a community needs assessment. So it's really just supporting all those different programs, look like developing educational materials one day to doing a training for OB providers the next day. A lot of it is reporting as well. So making sure, hey, we're gathering our data, we're compiling it in this fashion. We're actually working right now to better integrate our data, or actually not integrate, excuse me, extract our data from our electronic health record system and put it into a different platform, or kind of figuring out a better system for that, for all of the field nurses that go out and actually do the home visitations, if that makes sense. So yeah, I'm pretty much like the go-to person for all of those programs in a way, right? The non-clinical person that helps with all of those programs.